focusing not so much on strength, but focusing on flexibility, proprioception, balance, and core strength are things that keep you out of the doctor's office. If you wanted to focus on just a few things, those will keep you in the game.
Welcome to Living Real Change, a podcast from Piedmont Healthcare. I'm your host, Dr. Lacey Knight, Chief Health Information Officer here at Piedmont. Join us as we highlight the people, the stories, and ideas that are transforming care and strengthening communities across Georgia. From inspiring patient journeys to expert health advice, each episode offers insight, hope, and a closer look at what real change looks like in healthcare today. Today, we sit down with Dr. Seiler, an orthopedic hand surgeon at Piedmont. Dr. Seiler shares insights from decades of experience treating hand, wrist, elbow, and soft tissue conditions. We discuss advances in orthopedic care, including minimally invasive surgical techniques, emerging treatment innovations, and how restoring function can help patients maintain their quality of life. We also explore the importance of injury prevention and the role of prehabilitation in preparing patients for successful outcomes. And really happy to have you here on the podcast today, Dr. Seiler.
It's great to be with you.
Well, first, let's talk about your background a little bit. Maybe you can tell us what orthopedic surgery is, and then also talk to us about how you developed an interest in this specialty.
Sure. Orthopedic surgery in general is the care of all musculoskeletal conditions. So if you have a bone and joint or a muscle and tendon problem, orthopedics is where you need to be cared for. We do both non-surgical and surgical care. And my interest in orthopedics was really developed out of my own experiences as an athlete through injury. I ran across a great orthopedic surgeon in Louisville, Kentucky named Chuck Hargadon, who helped me work through ankle problems and let me get back to playing basketball, which is something that I was very passionate about. And so that kindled my interest in orthopedic surgery as a profession. And then within the Piedmont system, quality has been very important to what we're doing in the Piedmont healthcare system. So improving our quality and trying to deliver the same kind of care everywhere in the Piedmont system has been a real goal of the entire system, and certainly ours within orthopedics as well. And I've been pleased to help lead that initiative in orthopedic surgery.
That's great. You know, one of the things that I don't know that I learned in medical school about orthopedic surgery, but something I observed out in practice is just the nature of the work really lends itself to understanding quality. I think because you don't have some distant outcome somewhere, that you're not connected to. When you treat someone or you perform a surgery, you are directly connected to the outcome that you see. So it seems like maybe quality improvement and outcomes is really something that's been core to orthopedics as a specialty.
I think that's true. We are in general an acute care specialty. So you have the benefit of intervening around a problem and then able to drive improvement for an individual patient. And then through research, we've been able to aggregate outcomes that helps all of us do better with our patients. Orthopedics has a very active research registry. And so the research that's done, some of which is at Piedmont and nationally, has been very important to improving quality. But I think you're absolutely right about that.
So when did you first get involved in some quality improvement efforts in your career, and what did that first look like?
I was a director of the American Board of Orthopedic Surgery and ultimately president of the board, and I helped run the examinations for the oral examinations and also for the development of a certificate of added qualification in hand surgery and also sports medicine. So that's a toe in the water towards helping ensure that the public has access to good quality care. The subspecialty certificate of sports medicine is something we developed while I was on the board. So I was at ground zero for that project, which is something that's been very well received nationally by orthopedic surgeons and is a great way for them to demonstrate maintenance of certification or the imprintur of quality as seen by the American Board of Orthopedic Surgery, which is still very important to all practicing surgeons.
So that is a really interesting insight. Would you tell me what that means for patients? How should patients think about the notion of either board certification or specialty certification within orthopedics?
That's a great question because orthopedics and medicine, as you know, is a unique um, environment for practice. We are tasked with showing that not only we're competent to practice independently as we leave residency, but then every so often after that time, we must continue to demonstrate current knowledge and the ability to apply that knowledge in practice through the process that's called maintenance of certification. All of those things are housed within the American Board of Medical Specialties, and that's the best form of board certification in the United States. And it's a great place for patients to look to see if their doctor meets the test of their board for the practice of their specialty or subspecialty. And that's an easy check for any patient to make on the ABMS website, or in our case, on the orthopedic website through the American Board of Orthopedic Surgery.
Okay. So the board certification is a proxy for patients to understand that physicians have gone through the rigor of kind of maintaining certifications and learning the things that are expected for the specialty. And you've mentioned that above and beyond that, you've been involved in these clinical governance councils or quality leadership within Piedmont as a health system. Could you maybe talk to us a little bit about what organized quality programs led by physicians, like what does that look like, and how is that either sit next to or sit above or influence those kind of individualized credentials that we just talked about?
Well, I think the clinical governance councils at Piedmont are exciting because they give physicians the opportunity to collaborate around quality and stay centered on things that are very important to patients. So, with our clinical governance council, we've been focused on the development of specific care pathways for total joint surgery, for example, so that no matter what point you're cared for in the Piedmont system, you can get the same access to care as you would from any other point in the system. And all of the pathways are evidence based and they're also current to the best evidence. So those things add up to better care for patients, better outcomes for them over the long view. And Piedmont is unique in that sense. The ability of the physicians to meet and partner together on quality and then be heard by all of the administrative folks that run the hospitals is a novel kind of strategy that I think is very successful in the system, has really elevated care and made access to different types of care better. And as we that system continues to mature, then you will see increased ability to move patients around the system for the kind of care that they need or want to have in specific locations.
Okay. You mentioned kind of the total joint procedures as one example of the types of things that you work on. Would you maybe explain a little bit more about what that looks like? Is it for just the cases that are in the operating room? Does this involve looking at the preoperative care? Is it looking at the postoperative care? When you're in this group talking with your peers around how to solve to better outcomes and better quality, what aspect of that type of surgery are you looking at or focused in on?
Sure, that's also a great question. We One of the things we focused on is patient education. So we use a tool called Care Companion to help deliver specific points of care and exercises around the preoperative care for total joint patients. And then there's a second phase of operative care where we focus on the day of their procedure and try and use a pathway driven strategy to ensure that they get the best care possible based on the best evidence possible on that day. And then we have the same aftercare strategy. That's all just around patient education. We use different techniques for enforcing the pathways in the system based on the evidence so that you develop order sets that patients will receive during their care so that their care can be optimized to their specific needs. And those things are very helpful in terms of ensuring quality across a broad group of people. And that's been really successful. And we've been able to demonstrate significant improvements in quality in the Piedmont system using that strategy.
What kinds of outcomes have you been able to see an impact on for something like that?
One of the first things we tried to impact was surgical site infection, and by changing some of the pathways around preoperative preparation, operative strategies, we've been able to decrease surgical site infection in the Piedmont system, which has been very gratifying. We all know that we want that number to be zero, but there is a defined number that will probably always occur. But you're always working hard to keep that number as low as is possible. One of the best things that we've done is through the educational tools that we have developed. We've limited patients' needs for readmission to the system, which has allowed them to go home earlier and to be at home and have their convalescence at home. We've also been able to formulate new strategies for ambulatory total joint replacement so that patients don't necessarily have to be in the hospital to have a hip or a knee arthroplasty done. And that's also been very gratifying. Patients are much happier if they can be at home in their own bed, eating their own food, and participating in therapy as an outpatient. So those kinds of things have really improved the patient experience and have improved quality in demonstrable ways.
These all sound great, and I'm wondering what is different about the approach that you're describing, this kind of peer-to-peer collaboration and researching, than what, say, just an individual orthopedist might do or have access to be able to do to improve or manage their own outcomes and quality.
It's the collaboration among physicians to be committed to quality and then all agree to use the best evidence to drive the care pathways. If you operate in a silo or you don't have access to the sort of the wisdom of crowds, and then you may not be able to operate at the same level of evidence that we're able to operate at. We have great partnership with the Piedmont administration team that where they provide great infrastructure for helping manage the pathways, execute the pathways, and make sure the patients get the best care. But it's that collaborative experience among physicians and then between physicians and administration that lets you put the whole package together for patients. And I think that's one differentiator at Piedmont, the way we can deliver on that promise.
That's exciting. I'm wondering about kind of the data piece because, many people forget that physicians are trained scientists. And so, we tend to be very focused on data and outcomes and evidence. And so I'm wondering when you have to work from the kind of the clinical governance level to spread these insights or these recommendations or these practice standards uh, to individual physicians, what type of data actually matters to the surgeons? Like what type of information, lets them say, hey, that's really interesting. That would have a really strong impact on my patients.
We focus on three general buckets of outcome data. We focus on patient-reported outcomes, and that's very important to get their assessment of how we're doing. And that iterative information lets you feedback to practitioners things we can do better in different ways. And that was part of the reason that we developed the educational program that we did for patients, because that really helps them improve their experience along the way. And then whenever you're dealing with a complex system, we focus a lot on process-based outcomes that help us improve on the way patients get care in the hospital or in an outpatient environment so that their process through the day is solid. It's the same site to site. And by focusing on things there, we can improve their day of surgery experience. And then we also look through traditional lens of outcome-based standards where we check on surgical site infection, the rate of hip loosening, the rate of knee loosening, DVT occurrence. Those things are very useful because those are part of national initiatives that you want to show that you're practicing at the highest level possible.
At Piedmont, quality care changes lives. Meet Tom, a lifelong medic who suddenly suffered a stroke at home. Tom was diagnosed, treated, and in surgery within minutes, thanks to seamless coordination across the entire care team.
I've seen firsthand how every second counts. When I needed help, Piedmont moved with speed and precision, and that saved my life. A week later, I was back at home with my family, back to work and back to living.
Hear more at piedmont.org/quality care. Piedmont, real change lives here.
I think what I'd like to talk about next is where you see the field of orthopedic surgery going. You've touched on a few different things, but I'm thinking either types of treatments that may be changing over time based on advances in understanding or technology, things that you may be doing differently based on the available tools. I don't know if this is a space where, robotics or different surgical techniques is kind of introducing itself. But maybe you could talk a little bit about what you see are shifts in what may have been the traditional practice of orthopedic surgery and where things seem to be going, in the next few years.
Sure, it's exciting in orthopedics right now. We're in a specialty where treatment alternatives are expanding. They're definitely shifting more to centers that are ambulatory in nature, that have a center of excellence approach, and are of more limited invasiveness. And all of those things have great appeal for patients and for patient care. In my specific domain of hand surgery, the wearable microscopic tools that allow you to operate at high magnification without having the need of an operative microscope lets you perform more procedures more easily, also in an ambulatory environment. So that's a very nice innovation. The spine surgeons have really come a long way in terms of minimally invasive spine surgery. The anterior cervical spine discectomy infusions have really improved patient outcomes and can be done on an ambulatory basis. Total hips and total knees now being done in ambulatory care pathways. These are big shifts in orthopedics. They drive a lot of value for patients, and also drive a lot of value for the system. So it's a great partnership there. But these are physician-driven initiatives, generally speaking. This is part of the collaboration of the CGC, and somebody's saying why and somebody's saying why not, and trying to figure out what can you do here to really problem solve for what your goals are, which is always the highest patient care you can deliver. So that's our directionality. It's going to be more outpatient. It's going to be less invasive. And that will be something that I think patients will really value.
So it's very interesting. It sounds like a more precision-oriented approach to being able to solve problems. And how is this impacting the overall population? Are more or less people eligible for these types of procedures? Does this enhance access? What do you think is true there?
Well, in terms of access, Piedmont has done I think, a wonderful job of improving access, especially to orthopedic care, through the number of facilities that we're able to deliver orthopedic care through where there was no care. So general access is definitely better, but techniques of robotic surgery, optical magnification with microscopy, minimally invasive spinal surgery with intraoperative navigation tools. All of those things enhance precision and open doors to different types of procedures that have very positive outcomes. And so patients will be able to get that kind of care in the Piedmont system in a high quality way. And that's where we will continue to push in the Clinical Governance Council to develop assets that allow us to deliver care across the system.
I'm wondering if there are either new insights or new opportunities for, we'll call it the preparation for surgery or optimization for surgery. I know that with surgeons and with anesthesiologists, there's a lot of consideration in thinking about the patients before the surgery to make sure that they're in the best position for the procedure and for a fast recovery. Have there been any changes or different approaches in how you're able to address um, that preoperative preparation or evaluation?
For any elective operation, you have opportunity to get the patient in the best condition possible to undertake the procedure. And we have a large project that we're working on now with our colleagues in surgery, our colleagues in anesthesia, and our colleagues in medicine that focus on exactly that preoperative optimization to get the patient ready for surgery so that they can have good nutrition, good preoperative conditioning, appropriate management of their medical problems, be considered by the anesthesia service so that we can get them through the day of surgery in the highest quality way possible. But by combining all of those inputs, we'll have a common perioperative home at Piedmont for patients that need surgical care. And so if you need an elective operation, you're going to get the right preparation, you're going to get the right lead up to the surgery, and then hopefully that will enhance your outcome. There's good evidence that optimization of things like diabetes, preoperative optimization of blood pressure will contribute to better postoperative outcomes. So if we can execute on that idea, I think that'll be a real help in the Piedmont healthcare system. And that, like I say, that's a very active project right now. And we are working with our colleagues across specialty lines, not just within orthopedics, but to try and get the best system in place for our patients.
That's great. I have kind of a closing theme, and I'll ask a couple of questions, and then I'll give you an opportunity to kind of leave our audience with whatever you would like. So the closing theme is really around, what can I think about differently from a patient perspective? So I'm thinking about prevention. Are there things that I should do or should think about doing just to reduce the likelihood that I may need to see someone like you for an orthopedic injury?
I think prevention is a great topic and doesn't really get the sort of the play that it might. If you, from our standpoint in orthopedics, if you want to be an athlete and you want to be an athlete over time, focusing not so much on strength, but focusing on flexibility, proprioception, balance, and core strength are things that keep you out of the doctor's office. If you wanted to focus on just a few things, those will keep you in the game. One other thing I think patients or people, athletes, myself included, underestimate a little bit is the value of appropriate recovery. Sometimes you need a little recovery. You can't necessarily go quite as hard as you did when you were a few years younger. And so you need to balance activity with recovery and how to do that sensibly. And that's where having access to a good trainer, physical therapist, or occupational therapist goes a long way to help you structure programs that do that for you. And I think that's a great way to stay out of the doctor's office.
That is great advice. So the corollary to that is that should I be in a position where I have seen you and you're recommending that you're giving me the option to have either an elective surgery or it's a surgery that is less elective but something that I need, what are the types of things that I should do as a patient to just best prepare myself for those procedures? I appreciate that there's this kind of comprehensive program that's in development at Piedmont to help guide me through that. But what are the types of things that I should maybe take responsibility for doing to be in the best circumstance for a great outcome?
I think the first thing to always think about is, have I asked enough questions? I think understanding what you're taking on is one of the biggest challenges. We try and communicate well with patients and help them understand everything that we think is important for them. But often patients will have special concerns and considerations that we may not know about directly, that discussion around those things are helpful. And then, so asking a lot of questions is great. And I think patients that make a list, a roster of questions when they come into the office are great to interact with because they've already decided before the visit occurred what they need to get out of it. And then for most elective orthopedic operations, it's that prehabilitation phase. Can you get yourself in good shape to go through the operation and then have a good outcome on the other end? And so the muscle strengthening for your leg before your total hip and total knee can help you get through the operation in an easier way. So that prehabilitation phase is important, just as is the rehabilitation phase.
Some great advice. I will leave you just a few moments to give some final thoughts to our audience. Anything that you'd like to share?
I just want to comment a little bit on the value that you get in the Piedmont system. We have a great group of orthopedic surgeons that are geographically well located, so you can get care locally. If you need more advanced or specialized care, that's also available in almost all domains of orthopedic surgery in the Piedmont healthcare system. So we can help with almost anything that people need. And we have a great system of physicians that are always interested in getting you to the physician that has a high level of experience with your problem so that you can get the best outcome possible for your condition.
Thank you for listening to Living Real Change. To hear more stories from across Piedmont Healthcare, be sure to subscribe and watch for upcoming episodes. For additional health tips, news, and resources, visit us at piedmont.org/living-real-change.